Good afternoon and welcome. I can see that our webinar participants are moving into the room, and we're glad that you're here this afternoon. My name is Karen Odegaard. I am the External Affairs Liaison here at the Department of Health Services, and I'm going to be helping to moderate today's budget briefing on improving mental health and crisis services. Before we dive in, I do want to let you know that we are recording today's briefing, and we'll provide a link to the recording and slides from today to those who have registered. Please use the question box to ask questions during today's briefing, and we'll leave some time for questions at the end. I want to note that we may not be able to answer all questions today, but we will follow up with those whose questions we aren't able to address during our time together. And I'm excited to introduce our speakers for today, beginning with Secretary-Designee Kirsten Johnson, H.J. Waka, our Legislative Director, Ginger Steele, Administrator for the Division of Care and Treatment Services, and Andy Forsyth, DHS Budget Director, who is with us to help answer questions today. And now, I am pleased to introduce the Department of Health Services Secretary-Designee Kirsten Johnson to kick us off today. Secretary Johnson, let me turn things over to you.
Thank you, Karen. Hello, everyone, and thank you for being here today. My name is Kirsten Johnson, and I am the Secretary for the Wisconsin Department of Health Services. I'm excited to be here. Governor Evers' 2023 to 2025 breakthrough budget for DHS leverages Wisconsin's unprecedented surplus to make substantial investments in Wisconsin's healthcare, behavioral health, public health, and long-term care systems, as well as initiatives to advance equity and reduce disparities in our state. For our partners joining us today, we are so appreciative of your support to ensure this budget helps support a healthier Wisconsin. Thank you for the tremendous amount of work you do every day to protect and promote the safety and health of Wisconsinites in your communities. We need to ensure every Wisconsinite in every community has the supports needed in this budget that invests in our working families and drives economic growth. Good health is essential for everyone, and Governor Evers is dedicated to preserving and protecting the health of Wisconsinites throughout the state. Before we go into details of what's in the budget to support these initiatives, I will turn things over to H.J. Waka, our Legislative Director, to talk more about the budget process.
All right. And thank you, Secretary Johnson, for that wonderful introduction, and to thank you all for taking time out of your very busy days to come and join us this afternoon to talk about the governor's budget, as also specifically as it relates to mental health. And so before we get started, we would like to start with a high-level overview of the state budget process and where we are currently at in that process. Next slide, please. So I'm sure many of you have heard me say this before, but I do genuinely believe it to be true, is that the budget never really ends. As soon as one budget is signed and signed into law, the next budget cycle starts anew. And so if you're looking at the chart in front of you right now, the new part would start probably where at the top of the cycle, that red arrow, and then moves, clockwise down to the right. And where we are at right now is in that yellow arrow at the bottom of the circle. So in terms of the process, we've already gone through the agency submission requests that happened back in September of last year, at which point the state budget office and the governor's office go through those requests and then start putting forward their budget for this cycle. And once that process has happened, that sort of formally kicks off the entire budget season, whereby the budgets are out there for the agencies, LFB starts working on its process, start putting together papers, joint finance comes in and starts to work on its process in terms of reviewing the budget and then scheduling its series of hearings. And so where we're at right now is, like I mentioned, we're at that bottom kind of yellow arrow of the circle. And so what will happen now is that, and has already begun to happen, is that LFB will put forward their summary of the governor's budget, and then that is what the Joint Finance Committee is going to work from in terms of its analysis. They'll also be holding several agency hearings. There's 4 hearings that are scheduled to be coming up. DHS was not invited for a hearing this year, or at least not yet, at which point the Joint Finance will go on what they call the roadshow, where they travel across the state to solicit input and feedback from various people across Wisconsin. After that, once that happens, then they'll go forward and start putting forward their final motions for the budget. Those then become the next part of the budget bill. They will then vote that bill out of committee, and then it will go to the floor of both the Assembly and the Senate, where it will then be debated and voted on, and then signed into law by Governor Evers, probably after some line item vetoes that he has with his veto pen. But that's sort of the high level overview of the budget process. Next slide, please. And as I mentioned, you know, where we are in kind of these next steps is we are sort of in this early April, late March, early April process. And for those of you who can look at the screen here, you kind of see where we're going from here. But ideally, the whole process would wind up sometime end of June, early part of July. If past is prologue, that is where we've seen the last two budgets go. Sometimes, you know, that first week of July is when everything's signed and the governor has his vetoes. So hopefully that's what keeps going here. Again, as you know, the budget is the one bill the legislature has to pass every session. And hopefully that there's some good things that make it all the way through the process. Next slide. And as for those of you who may be interested in wanting to travel across this great state of ours, like I said, the Joint Finance Committee is going on its roadshow, and you can see where they're going to be here on the slide and when they're going to be there. So they're starting out April 5th, they'll be in Waukesha, then going up to Eau Claire on the 11th, the Dells on the 12th, and then up to Monaco on the 26th. And so if you are truly intrepid and want to make sure that your voice is heard at every juncture, I highly recommend if you can hop on the road to get to one of those and to share your feedback and help advocate for the initiatives in the governor's budget that you would like to see made into Joint Finance's budget. Next slide, please. So as we kind of move into this next process, you know, we wanted to give you, I know we're focusing on mental health today, but we do want to kind of give you a high level overview of everything that is in the governor's budget. And a cornerstone of this governor's budget, of Governor Evers' budget this time around, is focusing on the impacts that it will have for workforce and economic development in all communities across our state, as well as the critical investments that the governor is making to support working families and address long-standing workforce needs to drive economic growth. And next slide, please. And a part of that is the $17 billion annually that will be in DHS's budget. And that's a fairly large number. It's one of the larger ones for any state agency, but that's because there are a lot of tremendous, powerful, and impactful investments that are in Governor Evers' budget. And, you know, we're not going to have time to cover over everything today, but I do highly recommend after we wrap up here today that you go to the link that's provided in the slide, and we'll be providing these after the webinar today, and to go to that site, and it's going to have a whole host of information on not just what's in the governor's budget, but also materials that you can use for yourself, for your stakeholder partners, to help carry out the message of the budget, as well as to advocate for those initiatives. And feel free, as you go through those materials on our site, to pull those down, to make use of those, to make those your own, to help bolster your arguments as you continue to advocate for the initiatives in the budget that a lot of you have fought for to include in the governor's budget. So next slide. So what is in the budget? Well, there's a lot of big investments and key initiatives, but what we're going to be looking at, you know, high level is, you know, expanding Medicaid coverage, wanting to invest and build our healthy communities, improve our mental health and crisis services, which is the focus of today's conversation, as well as making investments in our long-term care services and infrastructure, and addressing the staffing and workforce needs across all of our healthcare sectors. And I know, like many of you, we have heard nothing, you know, but workforce for quite some time now, particularly in all areas of healthcare, not just in mental health, but across the board, but keenly felt in mental health as well. So today we're going to be focused on investments that, again, focus on mental health and improve crisis services, but we would be remiss if we didn't make our mention in our case for Medicaid expansion. So next slide. And once again, Medicaid expansion is in the governor's budget. It's hugely impactful. There are a lot of investments and initiatives that are made possible in the governor's budget because of Medicaid expansion. And one of the big reasons that is partly due to the $1.6 billion in savings that would be generated by expanding Medicare. And not only does that provide a way for us to cover an additional 90,000 people on Medicaid, 30,000 of which of those are uninsured, but it does provide the ability to make critical investments in our state's healthcare and healthcare infrastructure. Now, for those that don't know, Wisconsin is one of only 11 states that has not expanded Medicaid, And that number is on standby to go down to 10, with North Carolina working on a process to get Medicaid expansion through their legislature. And that's been happening here in the last couple of weeks. Another key thing that's on top of the savings is how tremendously impactful Medicaid expansion is for workforce. Now, that might seem a bit counterintuitive, but we've seen before that by increasing expansion in states where they've done that, you've seen increases in economic output, you've seen increases in people being able to find and maintain full employment, as well as to help prevent any sort of medical bankruptcies. So not just does it help the bottom line of the state, it also helps the pocketbooks and the bottom line of the people that would benefit from these services. Next slide, please. And so from those Medicaid expansion savings, what would we then be investing those in? And like I said, that's $1.6 billion in savings. That number only keeps going up. It keeps going up every year. But that will allow us to make significant investments in improving our public health infrastructure. Having just been through the pandemic, I think we can all agree that there's a lot that can be done. Our team did a tremendous job in dealing with the pandemic and working with the pandemic. But we also found out that there's a number of significant investments that need to be made there. Strengthening and improving our behavioral health systems, investing in our long-term care systems, as well as making health insurance and prescription drugs more affordable. And so again, I'll keep saying it, not just are these key investments for our infrastructure, for our healthcare, but it's good for our workforce, it's good for our families. And again, something that there's just only, universal positive benefits here. So want to continue to make that case for Medicaid expansion and reiterate how tremendously impactful and important it is to the health and stability of Wisconsin. So having said that, I will move into the part that you all came here for, and that's to hear about all the mental health investments in Governor Evers's 2023-25 budget. And for that, I will turn it over to Ginger Steele. Take it away, Ginger.
Thanks, AJ. The past few years have been really tough on all Wisconsinites, and Governor Evers' budget recognizes that behavioral health is essential to overall wellness. Governor Evers declared 2023 the year of mental health, and his budget builds upon that declaration by making significant investments in expanding the availability of behavioral health services so that Wisconsinites can receive care closer to home. We must all do what we can now to ensure those who are in need of mental health support have that access to that care when they need it. We really can't look back 2 years from now as we prepare the next budget and wonder whether we should have done more and take action sooner to take care of our own mental health and others' mental health. The budget supports a vast array of diverse and inclusive services to improve crisis response, to invest in mental health access for people across their lifespan in their communities, to fund suicide prevention efforts, as well as expand substance use disorder services. The budget also helps ensure the right supports are available at the right time by expanding an integrated behavioral health system that provides prevention, intervention, and treatment services for all Wisconsinites. Next slide, please. So according to the latest Youth Risk Behavior Survey from the CDC, about 42% of high school students experience persistent feelings of sadness and hopelessness. They also released data last month that shows about 50% of US teen girls felt persistently sad or hopeless in the year 2021. This is double the rate of boys and represents a nearly 60% increase in the highest reported level over the past decade. The report also confirms ongoing and extreme distress among teens who identify as LGBTQ+. And as we know, it's not just our children who are in need of care. There are millions of adults in the US affected by mental health concerns each year. So based on the 2020 data from the National Alliance on Mental Health, 1 in 5 adults in the US experience mental health conditions each year. Next slide. So on this slide, let's take a look at the graphic related to Wisconsin's youth crisis system. This graphic shows available and proposed resources for youth experiencing mental health situations or substance use issues. And the goal of Wisconsin's youth crisis system is to be able to provide the right care in the right place at the right time for all Wisconsinites. So let's start with someone to talk to. These services are all available statewide. There's the Peer Run Warm Line. And so those in need can call, text, or chat with individuals with related life experiences for non-emergency support before situations become an emergency. This service is expected to be available in 2023 and is ARPA funded through September of 2025. Next, the 988 Suicide and Crisis Lifeline. Individuals in need can call, text, or chat to connect with the counselor. And this effort is funded through federal grants through September of 2025. The Hope Line, people can text with operators trained to provide emotional support. And this service is funded by state GPR and the Center for Suicide Awareness. And then there are county crisis lines where individuals can call to talk to behavioral health professionals or trained volunteers during an emergency. And this service is funded by county budgets and Medicaid reimbursements. There's also someone to respond. These services are currently only available in certain areas of Wisconsin based on local support. There are county mobile crisis response plus enhanced response teams. And this involves at least one first responder or behavioral health professional responding in person to de-escalate and provide support, and is funded by county budgets and Medicaid reimbursements. Enhanced response teams involves a group of up to 3 first responders and or behavioral health professionals responding in person during an emergency. The co-responder models provide a mobile response using law enforcement and behavioral health professionals for individuals during an emergency, and this is funded by municipal budgets. There's a safe place to be. These services are only available in select areas of Wisconsin, and it's the intent to have all services available regionally with additional funding. It includes youth crisis stabilization facilities. These are residential settings that provide counseling, therapy, and other services to youth ages 17 and under for up to 30 days, which is funded through state GPR and federal grants. And then also mentioning private and public hospitals. And these are facility settings that provide intensive inpatient care and treatment from behavioral health professionals. They're funded through patient payments, private insurance, and Medicaid payments. The budget also includes 2 initiatives that would strengthen the youth crisis system and ensure youth in crisis have a safe place to be. The first one is psychiatric residential treatment facilities, or you'll hear us refer to them as PRTFs. These are non-hospital settings for youth that would offer intense, focused treatment to really promote a successful return home or to a less restrictive community setting. Funding is needed, and a state budget proposal has been put forth for this initiative. And then there's the crisis urgent care and observation centers. And these are facility settings similar to hospital emergency departments that would offer assessment and support from behavioral health professionals. Funding is also needed for these types of facilities, and a state budget proposal has been put forth as well. Next slide, please. Regarding crisis responses, we are clearly wanting to improve this. In recent years, Wisconsin's crisis system has faced rising service volumes, with counties responding to about 35,000 crisis calls statewide in 2021. This has really increased burdens on county services, law enforcement, and hospitals and other providers to respond to people who urgently need this care. And Governor Evers' budget supports the development of up to 2 crisis urgent care and observation centers that would serve as crisis service hubs and offer a range of behavioral health services to anyone from walk-in appointments to first responder emergency detention drop-off. Total funding equals just over $10 million for this initiative. The budget also supports youth crisis stabilization facilities. The state has recently developed 3 crisis stabilization facilities specifically designed for the needs of youth experiencing crisis. This budget proposal provides about $1 million in stable, ongoing support to ensure these facilities continue to serve youth closer to home and to support the needs of the communities they are in, as well as reduce the need for more intensive treatments. Next slide, please. So talking about the psychiatric residential treatment facilities, a PRTF is defined under federal law as a standalone inpatient psychiatric setting for youth that is not a hospital. So PRTF programs are intended to offer intense, focused mental health treatment to promote successful return home or to a less restrictive community setting as soon as clinically feasible. This initiative would allow DHS to create a new provider type serving youth with behavioral health treatment needs and includes about $1.79 million to establish a 25-bed facility. It also allows Medicaid benefits to include a psychiatric residential treatment facility benefit. Next slide, please. So investing in mental health, we're hoping to continue funding peer recovery centers and expansion. Peer recovery centers provide no-cost, person-centered advice, skills training, and a place to connect with others in the local community who have lived experiences with behavioral health conditions. The budget provides ongoing funding to support the existing 8 peer recovery centers in the state and the establishment of 2 new centers to expand access to areas not currently served by any of the existing centers. Total funding requested is about $520,000. It's also proposed that the budget provide for the offering of culturally and linguistically affirmative behavioral health services to those who are deaf, hard of hearing, or deaf-blind. In 2019, the University of Wisconsin's Population Health Institute completed a behavioral health gap study, and among the results found the deaf and hard of hearing community is really underserved and lacks access to qualified direct service providers. Governor Evers' budget proposes developing a statewide behavioral health treatment program directly tailored for those who are deaf, hard of hearing, or deaf-blind, where people will receive treatment directly from a behavioral health provider. Total funding, just over $1.9 million. The proposed budget also provides for the improvement of accessibility and affordability of receiving critical mental and behavioral health care. Mental health treatment can be hard to find, especially in rural areas of the state, and Governor Evers' budget provides funding to provide vouchers for mental health services that can be used either in person or via telehealth appointment for farmers in rural areas. Affordability is also a barrier to receiving care, and in emergency situations, people often do not have the ability to choose what type of care they receive or where they receive it. And this budget request would increase cost transparency and protect people against unreasonably high medical bills for behavioral health services received during a crisis. Next slide, please. Investing in mental health services in schools. So to address the high and increasing prevalence of mental, behavioral, and developmental health concerns in children, this budget makes historic investments in improving and expanding services in school settings. Children spend a great deal of their day at school and are more comfortable receiving mental health services in a school setting rather than outside of school. Students in schools with access to mental health services are also less likely to experience depressive episodes, suicidal ideation, or suicide attempts. Among other initiatives, the budget would increase the amount of federal Medicaid reimbursement returned to schools through the School-Based Services, or SBS program, increasing funding to schools by about $112.4 million over the biennium. Additionally, it provides nearly $11 million to improve access to telehealth in schools, by allowing school districts to bill Medicaid for reimbursement as telehealth originating sites. The total funding is $123,394,900. And another requested investment is to expand access to psychosocial rehabilitation services. So psychosocial rehabilitation services, or PRS, are a category of services that help people with mental illness or substance use disorder manage their day-to-day lives. The services are often complementary to psychiatric care, drug therapies, and other treatment people may receive for their condition. PRS treatments and resources vary from case to case, but can include medication management, psychological support, family counseling, vocational and independent living training, housing, job coaching, educational aid, and social support. Governor Evers recommends providing funding to expand Medicaid benefits to include a psychosocial rehabilitation benefit, and also recommends DHS provide reimbursement under the benefit to non-county partners. The budget requests the ability to utilize marijuana excise tax to support behavioral health services. And under Governor Evers' budget, DHS would distribute excise tax revenue generated from the legalization of recreational and medicinal marijuana to counties to support their behavioral health services, alleviating revenue pressures that counties have been experiencing in recent years. And then lastly, support is requested for qualified treatment trainee grant, the Qualified Treatment Trainee Grant Program, or the QTT. The QTT grant program facilitates the licensure and certification of those in the process of obtaining or already have a graduate degree in psychology, counseling, marriage and family, therapy, social work, nursing, or a closely related field. And this helps to address the shortage in the behavioral health workforce. Next slide, please. Funding suicide prevention efforts. This includes a request to expand staffing and resources for Wisconsin's 988 Suicide and Crisis Lifeline services. Lifeline services, answering calls, texts, and chats from residents throughout the state, went into effect in July of 2022. The counselors at Wisconsin Lifeline are trained to listen and support people through their distress with a focus on de-escalation and coping skills. The budget provides state funds to maintain the call centers and support the increase in call volume the Lifeline has experienced since its launch. Total funding, just over $3 million. And then lastly, a goal of establishing a suicide prevention program has been put forward, and DHS will create a suicide prevention program to coordinate suicide prevention efforts across the state. The program will also develop and provide educational materials and public awareness campaigns on suicide prevention. The program will further provide grants specific to prevention of suicide by firearm use and support staff trainings at firearm retailers and ranges on how to recognize those at risk. Total funding, $1 million. Next slide, please. So last but not least, expanding substance use disorder services. About 8% of Wisconsinite, and that's approximately 450,000 people, have a substance use disorder. And in the last decade, Wisconsin has seen opioid drug overdose deaths triple. Deaths involving the use of stimulants have also been on the continued rise in our state. And substance use and its adverse effects continue to impact our communities on a deeply personal level. So the budget outlines the development of integrated behavioral health stabilization, intoxication monitoring, and detox facilities. The budget supports the development of these behavioral health facilities by expanding Medicaid reimbursement to include these new facilities. These facilities provide patients information on harm reduction strategies, connect them with community resources, and aid in transferring them to a level of care they need upon stabilization. Medicaid coverage would be effective July 2025, and the total funding is zero, as this involves a proposed statutory language change. We'd also like to further support addiction prevention and treatment responses. Governor Evers' budget recommends providing funding to support stimulant treatment services in counties of high need to meet the increased demand for treatment service availability. Total funding, $3,288,000. And finally, we'd like to be able to ensure accessibility of needed residential substance use services. Affordability can often be a barrier to getting treatment for Wisconsinites who are struggling with substance use disorder. Medicaid implemented reimbursement for residential treatment and recently expanded coverage to institutional settings. This reimbursement covers only the cost of treatment and not the cost of room and board at residential facilities. This budget provides funding to expand Medicaid benefits to include coverage of room and board costs for the residential substance use disorder treatment. And the total funding is $16,619,000. So that concludes the mental health and crisis services initiatives we're highlighting today. I'm going to turn things back over to Karen.
Thank you so much, Ginger. Really appreciate that comprehensive overview of what is included in the budget related to mental health. Wanted to just reiterate that additional information is available for you on our website. And so we'll put that link back into the chat here shortly. And as we noted at the beginning, we have been recording today's webinar, and we'll provide a link to that recording and slides from today for those who registered. And with that, we'll open the floor for questions. You can please use the question box, and we do have a few that we can get started on. So let me start with taking us back to the crisis urgent care work that we have included in the budget. And I'm hoping that Ginger, HJ, and Andy may all be able to chime in just to provide a bit more context about what that funding is intended to cover. And then if we can also help understand there's a position associated with that funding and what that position is aimed at doing. So let's just take a look back at that and talk through what the crisis urgent care funding will be set up to do in this budget.
So Karen, I'm happy to take a quick crack at that. And so kind of as what I'll do two parts. So what's in the $10 million? The $10 million will allow us to develop and create a proposal for up to 2 crisis and urgent care observation facilities in the state. That's why I say up to 2, and they'd be up to 15 beds. And those beds would cover, and I want to make sure I get this right here because there's a lot that goes into it. Andy, please, and Ginger, step in if I get anything wrong. It would allow us to accept referrals for anything that comes in the door. So that's not just emergency detentions, but also crisis services for both youth and adults, any involuntary patients under emergency detention, voluntary patients, walk-ins, individuals that are brought by law enforcement, emergency medical responders, or any other emergency medical services practitioners. They won't be required to have medical clearance. These facilities will be able to provide assessments for physical health, substance use, and substance use disorder, mental health, provide screenings for suicide and violence risk, as well as provide medication management and therapeutic counseling, provide coordination of services for basic needs, and have adequate staffing 24 hours a day, 7 days a week. So serving as this, we have our stabilization facilities, we have our hospitals, and there's a gap right in the middle. And these crisis and urgent care observation facilities would fill that gap for folks that, maybe too severe for a stabilization or too severe for any sort of day treatment, but don't necessarily need to be going up to Winnebago. So it's filling that gap. And so the FTE for that position, that FTE that's associated with those crisis facilities, that's intended because this is a brand new facility type. We are going to need someone that's going to be able to help manage the request for proposals as we put those to develop and manage the RFPs and RFIs as those come in, develop the grant program, as well as develop the rules. And that's going to be a fairly significant project, is because this is a whole new facility type that we're creating, we have to have the statutory authority necessary to create it. We cannot do any of this within our current regulatory or statutory structure. So we have to develop new rules, and that's just going to take a significant amount of time and resources at the department. And that's going to be the reason why we have that one person, that one FTE, to be able to draft the grants, to be able to draft those proposals, to be able to craft rules, as well as to monitor and evaluate the effectiveness of this program going forward. So I think I got most of it, but Ginger or Andy, if I missed anything, please step in.
I'll just add that that $10 million estimate was based on, we tried to estimate the types of staff and how many staff each center would need to provide the services that HJ mentioned. And that's how we arrived at that cost estimate.
Beautiful job. Thank you, HJ and Andy.
And I will emphasize that is on the low side. We always want to could use more. And this is, again, that $10 million is to provide that startup cost, because we do want to eventually move towards more sustainable sources of funding and reimbursement for these facilities once they're up and running. But we need to have that initial foundational investment to make sure that we can set them up for success.
Great. Thank you so much. Andy, I wondered if you could talk a little bit about the funding for CSP and those services being funded in the budget. Specifically, is that for a certain period of time, or will that be on an ongoing basis?
That would be ongoing. So yeah, the governor's budget would provide GPR funding so that we're fully funding counties to deliver CSP services. And so that would be a permanent change to the funding for CSP.
Thank you so much, Andy. So there are a few other questions in the question box about looking for more specific details about the crisis centers. And I know that this is an area of work that folks are enthusiastic about and I think feel the sense of need for these types of facilities. I wonder if we can just sort of maybe re-articulate or restate sort of the process and where we are today and what decisions are not yet made and what decisions are yet to come. So I don't know, HJ, if you want to take a crack at that. Thank you.
Are you just referring to crisis services in general, Karen? Just how we got to where we are?
Well, I know. I think the question is more like, where are they going to be and who are they going to serve? And I think trying to understand that we are in an early part of this process, and that maybe I'll just answer the question. Many of those decisions are yet to be made, and that will come forward once we get through the budget process, once we move into actually, setting up the RFP and setting up those processes to make those decisions. So the details many of those finer points on the details are yet to be determined.
Yep. And to build off of that, Karen, with regards to the crisis services facilities, I know people are really interested in where these are going to be. And that's the whole reason we're doing the RFPs. We want to make sure that where these facilities are going, they'll be able to serve as many people as appropriately as we can, that there is the existing infrastructure in place to be able to successfully operate these centers. I think that's going to be another part of that process. And that's where we get back to why we need, the statutory and the regulatory authority, which then creates the ability for us to have an advisory committee to help inform and to help weigh in on what people want to see and where they would want these places to go, so that as we put out those requests for proposals, we can take that feedback into account in terms of, one, just developing the grant, and then also figuring out how that'll be scored in terms of where these will go. So we do not have there are certain parts of the state that may be further along, but that doesn't mean that they're the only places or that they're the best parts. So that's going to be part of this iterative process of engaging with stakeholders such as all of you on the call to get all the feedback and input that we can to make sure that when we stand up these crisis centers, that they are stood up to be successful. And I also saw another question in there regarding the cost of the centers. That's what the $10 million to help cover those upfront costs, because as we move forward towards implementing, we are going to want to create and build some more sustainable cost funding mechanisms. I know we just talk about a cost-based rate, but we need to have the data in order to do that. And that is the point of the $10 million, is to provide that initial upfront operational funding for the planning and the implementation. That's where that figure comes in, and that's what will allow us to do that going forward.
Thanks. I'll just add a couple more sentences. There's been lots of questions about the funding, and so for the crisis urgent care and observation centers and the $10 million, and so the estimated cost was based on typical cost for facility operation and staffing, et cetera, and it's just a base estimate. As these types of facilities don't exist in Wisconsin. And so HJ already touched on this. DHS needs an administrative rule, the rulemaking authority, to create these new types of facilities. And then with the caveat that if that is granted, it takes about a year to develop an emergency rule. So it's estimated that the facilities wouldn't really be projected to open until probably the second year of the biennium. So just some additional information.
And to build off of that, given that the amount of interest that has been around this process for the past few years now is overwhelming. And it's one thing for the governor and the DHS to put it into its budget and into its request, but it's not just going to be enough for us to go out there and continually advocate for it the way we have been. We need your support. We need significant stakeholder support to further reiterate, advocate the need for these centers, because the more people that are advocating for this need within our communities, the more likely and the more and the higher the chance of success for us to get this through the entire budget process for this biennium. And we had some of it like this last biennium, but we didn't get any of the rulemaking authority to stand us up. And that's the critical part that Ginger mentioned. Like, we have to have that. Without that, we're not going to be able to stand these up the way that we need to best serve the people in our communities.
Thanks, HJ. We do have one additional sort of detailed question, and this is related to the psychosocial rehabilitation services, and wondering about with specificity around, will independent certified clubhouses qualify? And I want to check with you, Ginger. I'm not sure if this also falls into that sort of same category of implementation details will be defined as we continue moving, or if we have more specifics today.
Yeah, I don't have any specifics to add to that. Thank you, Karen.
Yeah. And again, thinking about, as HJ just said, where we are in the budget process, that today, I think the focus is trying to keep these opportunities in the budget so that we may be able to get into those details of how we implement these programs once the budget is confirmed and finalized. With that, I know we do have a few other questions that we'll be following up with folks offline later. So at a later time, that will take just a little bit more time to follow up with folks. And so right now, I'd like to move us to closing out for today. And I really want to thank you again for spending part of your day with us, for your interest in your work in this space. This is an incredibly important issue and variety of topics that we're working on in the budget, and just so grateful that you're here with us today. I want to reemphasize that if you'd like to learn more about the budget, you can do so on our website, and we will be continuing to build out our budget website with additional resources throughout the process. And finally, I want to thank Secretary Johnson, HJ Waka, Ginger Steele, and Andy Forsyth for walking us through this focused area of the DHS budget. Really appreciate all of you and your expertise today. And then finally, just again, my great appreciation to all of you for taking time to be here today. Have a wonderful rest of your day. Thank you so much.
Thank you, everyone.
Thank you.